from every about 25 to 50 cc's of fat that we can get and concentrate and use, we usually get about 80 to 100 million stem cells that we can use at the same time, which, as Kevin was saying, you can get that reliably every time in every vial. You know, that's their kind of their promise to us, that you're going to have the adequate dosing, so you know how much you're going to be able to treat your patients. And most patients need to treat inflammatory conditions, depending on what you're treating, but you usually will need about 50 million cells or up to 100 million cells. So it's a good dose.
And what are you in the regenerative space mostly treating patients for with stem cell therapy? I mean, you have a wide specialty across the board. So curious what you're most excited to be using the cells for your patients.
So, you know, again, this may be a little bit longer conversation than we all want, but so interestingly, about 5-6 years ago, I began using certain supplements, certain therapies in the office, and I began to notice a difference in my patients and in the way they were healing. And I created a very extensive perioperative protocol that we call Healio therapy, which you will find out soon of what that is. And for many years, I was always looking to see what was my fifth pillar that I had to put into my heliotherapy that would make this actually a very revolutionary procedure. And when I found out that we were able to use our own stem cells from our own fat in an office setting, and not only that, that also being able to freeze them, expand them to use in the future, I'm like, this is it. This is what I had been waiting for. And hence the birth of heliotherapy, which is our perioperative protocol. It's concentrated on 5 pillars. And the first one, autologous stem cell therapy, nutrition. We also have biologic, regeneratives, IV therapy, oxygen therapies, and photobiomodulation. Those are the 5 most important things. But you know, the most important thing with the things that we do with surgery and the surgery of the future is going to be recovery. Well, I've learned this through many years, and I also talk to my colleagues about this. It's like, you're 10 years in practice, 15 years in practice, 20, 25 years, you may become a surgical master, but that's all you can control. What are the other things that you can help your patient to recover faster, to get them, you know, to get them walk faster, to get them to heal faster, to get those wounds to heal faster, to get them to, you know, back to their lives. I think that's the most important thing. And in this era that everybody wants everything faster, that's why the regenerative part of this is really the key here. You know, to be able to, you know, after you're performing surgical trauma, right, to give them something, right, from their bodies, back to their bodies, to help lessen that bad inflammation for those first few weeks, and then start the regenerative process and help them build that tissue and build it well.